why do people choose home birth? We know there's a lot of different reasons. We all kind of choose, like everybody follows the hospital, but why are people choosing a home birth?
Do you want to know like particular reasons, like from particular people or in general?
Just in general.
Like, okay.
In general, why, like Liz, why did you choose a home birth?
I chose a home birth. My first home birth was not my loss. I had 3 home births, and that was the last one that I lost my baby. But the one that I had one birth before any home births, and it was in the hospital with midwives. But in my city, the midwives all got kicked out of all the hospitals. It was this whole thing between doctors and midwives, and they were certified nurse midwives, but they were basically, there was no hospital when I came to have my second baby that had midwives anymore. And I felt unsure about seeing a doctor. I'd never seen a doctor. I'd only seen a midwife. I'd never even gone to a gynecologist. So I was like really uncomfortable going to a doctor. I didn't feel like I would be listened to or whatever. And so I chose a home birth and kept having, it was successful. So I had another, and that was successful. So I had another, and that one was not successful. And my baby died. So I liked having my kids there. I liked being in my house where it was comfortable. I liked being able to eat during labor or swim around in the birth tub. There was no water of any kind except like a shower at any of the hospitals in my city, even though it was a big city at the time. Things are very different in the cities that I've lived in since then and nowadays. But, back 15 and 10 years ago, even, it was just very different settings. So that's why I chose home birth.
Candace, did you have something you want to say?
I don't know from personal experience, but briefly, when I considered it, the biggest point was just being in your own home. Your kids are there. A lot of people have sitter issues or no family around. So just being there for your own children that are already in the home is one of the biggest, I think deciding factors for a lot of people. And you don't know about the risk. You only see the positives and things like that. You stay in your home. You don't have to go anywhere. You get to have your own meals there. You get to have the baby right there, put it in the little bassinet. Everything's right there. I know a lot of the issues are hospital protocols and standards. Sometimes your baby has to go away to the doctors and nurses, and you don't get that one-on-one time. I know it's changed a lot. Now, I don't know. It's probably per hospital. The baby can stay on you as long as the baby's healthy. But that's another, I think, one of those draws for a lot of people when they see that. So, you can stay with the baby.
I agree with that because I think that's part of what we chose. We had some weird medical stuff that made us kind of a little bit, I don't know, like we just didn't feel comfortable with the hospital and the doctors. I was pregnant, went to a doctor appointment to meet the doctor. They didn't even want to meet my husband now, but boyfriend at the time. The doctor didn't even want to meet him. I was newly pregnant, like basically, and they just kind of shoved us out like we were a number. That's the feeling that I got, was we were just a number. Here was some medicine, here's some stuff. Don't take this, eat this, don't eat this, bye. And so I left feeling really like upset and didn't know. I was like, oh no, I have to find another doctor. And it was really disappointing. It was my first time being pregnant. And I'm like, now I have to find another doctor. And how am I going to find one? Because I picked a bad one. How am I going to find a good one? And then here was natural birthers being like, come with us. It's great. And meet my midwife. And then you meet there's a bunch of midwives, and pick out your midwife. And so we kind of fall into that of where it just seemed nicer. You can be at home. You don't have to leave your house. You can birth at home. You can get up and move around. I wanted a water birth, so I thought, cool, I get to be in the tub, I have my baby right away, baby doesn't get taken away. All those things that you're thinking is just the image of what you see of what birth is too, like of a home birth. You see the videos, you see the pictures, and of like baby coming out and like, yay, you have your baby. So that's what we wanted when we chose our home birth. So
I think there's a lot of information. I remember early in pregnancy with my first that there was a lot of information out there. I think that My first was born just a couple years after that Ricky Lake documentary came out. And so there was a lot of people that was presented as home birth was safer. So that in the hospital, you were going to have the cascade of interventions and you were going to get cut open. You were automatically going to have a C-section, and that C-section was going to be unnecessary, and that you could prevent all of that if you just had your babies at home. A lot of those conversations around women have been doing this for thousands of years, and birth is safe at home. There's no need. Birth is not a medical event. You know, a lot of those things that you hear in the natural childbirth community, it's synonymous with home birth. You know, you'll achieve these things, or you'll have that experience, or you'll get this outcome if you have a home birth with a midwife. So I would say that's a reason people choose it as well.
Hmm.
Do you think people are choosing a home birth because they're getting this idea that it's cheaper than a doctor, whether you have insurance or you don't have insurance? Do you think anybody's thinking, oh, if I have a midwife and I'm home and not having the hospital bill and the doctor bill, it's actually cheaper?
I didn't, because my insurance would have covered pretty much everything. I mean, I would have had a small deductible, but I had to pay cash for all 3 of my home births. But my third one, the one where my daughter died, was actually, that insurance did covered the midwife. But then, so she was paid a full payment, even though she was like negligent. So, I don't know. I didn't think it was cheaper because I had to come up with the cash, whereas because most midwives don't take insurance. So that's not, can't just pay a copay.
I have heard that some people do choose it because it's more affordable, in the sense that a lot of midwives, they don't take insurance, but you can barter. You can give them things. I know there's a local midwife, gas cards, grocery cards are on her list. You can work at her birth center doing yard work or repair work. There's just a lot of possibilities. She said, what do you have? Let's talk. And there have been midwives that I knew in other locations who took things like jewelry, mountain bikes, things that they thought were valuable, and they would deduct that from their fees.
And I've heard a similar thing here in Vegas. Actually, I heard that some of them even do childcare if the midwives have that, or birth attending. So you have a midwife and her assistants, and you're actually getting people that you think are the assistants or other midwives or maybe doulas, and they're actually people trying to pay off their birth. So they're going there to feed the family, they're going there to clean up, they're going there to help support the mom, maybe massage her, or check her out or help her get in and out of the tub and all those things. It's actually they're actually paying off their birth that they had or that they're going to have. Some of them are pregnant doing this. So that's actually something that I've heard here. Same thing. Or they work at there were like kind of like clinical things or whatever, like setting up appointments. That's another thing, is where they take their phone calls like assistant. I've heard a lot of that where it's like a trade. You're doing some type of trade, either a service or you're giving stuff or whatever instead of just doing cash.
And I know that, there's a set fee that I've heard or, read too when I was considering a specific midwife, but you don't see it did look better on paper, like, oh, this is cheaper than what you're kind of given at the OBGYN's office when you go in. But at least those numbers are laid out. You don't know, you're supposed to buy the birth tub or you're supposed to buy this and that. Like, they don't bring a lot to your house. So that also adds up in the end. And those just aren't things that you're told right away. Usually, I know when you're meeting with a midwife or when you're considering it and see the numbers, oh, this is maybe cheaper, but usually you'll hire a doula or you might have to pay their assistant and then buy your own supplies. That can add up that you don't know about.
Well, yeah, depending on the birth kit, they have the prepackaged ones and you go through, they have the different companies that do it. And some of them are great, but they also say, oh, buy 2 because, there's only so many chucks or so many gloves, we might need more. And you're thinking, okay, that's expensive, a couple $100s for a birth kit.
And then according to what I've heard, can't say anything firsthand, but midwives are either will ask to take any extras off your hands or they'll demand it. They'll be just, okay, this is mine. You paid it for it. Your midwife walks off with it. So I always think that if you paid cash for something, it's yours. But of course, she's going to tell you that, oh, you don't have any use for this. I can use this for the next person. Oh, there might be someone who can't afford it. And then off it goes with her.
I remember doing our kit because I didn't know that you had to buy a kit, and it's very confusing. And she gave me a website, and I would go on this website, and you can it's like shopping, and we to get our stuff. She had a tub for us, but we had to buy the liner, which I was like, okay, whatever. I'm getting on there, and there was like a basic kit. So here's your liner, and here's your gloves, and here's all this like stuff in there. Do you want to get your kid's DNA test? Do you want to get I was like, I don't know what any of this is. There was like a bunch of things that you could add on. And did you want to have like your baby's like handprints? And do you want to do there was like all these things. Like it was literally like shopping. Like you were just shopping. And so it would be like, here's your basic kit, or you can get an advanced one, or you get a super advanced celebrity package, I think it was called, or something like so something like that, where it was like super extreme. And I think my my kit, which by the way did not include the tub because the tub was already paid for, was just the liner. I think just to get the liner and the gloves and these little things that you would think like your provider already has all that stuff, I think it cost us, I want to say, I'd have to go back and look for sure, but I know it was over $300. I'm pretty sure it might have been about $500. And that was not including the tub, which by the way, later on after I bought my kit and then you have to wait forever for it to come in, I looked at birth tubs because I was like, maybe I want to buy my own and not birth in a tub that everybody's birthing in. And I seen them and I was like, I could have bought a tub cheaper than I bought for freaking lining and gloves and all this stuff. But I didn't know that at the time. She made it like they were super expensive. So I bought the lining and also, so I was like, fine, I'll just have the whatever tub that everybody's birthing in and not have my own. So, but yes, it's very confusing. And it was really weird because there was things in there that I didn't know. And it was like a syringe. And there was like stuff that I was like, I shouldn't be picking this out because I don't know what is needed and what is not needed for a birth. I had no idea. So I just was like, okay, we'll do this and we'll add some fun stuff in there and whatever. But yes, that was the price on top of the thousands of dollars that you spend for your midwife just to be there. And then also if anything goes on and let's say suddenly you're going to have twins, if your midwife doesn't do twins, which a lot of them do, but let's just say yours doesn't, she doesn't, whatever, she brings another midwife in that deals with twins and you have to pay her a fee too. Maybe not as much as your other one, but she's the specialty midwife for that. So that was, or breech, if you had a breech or whatever. I remember I was told about breech and if you're going to have twins kind of thing. And I was like, oh, both of those sound really scary. So yeah, that was another thing is there's a lot of things that go tacked on that you don't know and you're paying cash up front and you have to do it by so many weeks being pregnant because, you can go early and have your baby early. But yes, the birth kits are very interesting, very interesting.
Well, the one thing I know about lay midwives is they generally, if you have to be referred out for any kind of tests, if you want to opt for an ultrasound and they don't have a provider, that's on you. Sometimes the midwives will refer you to somebody. Sometimes they will tell you that it's your job. If you need that if you want that 20-week ultrasound, you have to go get it yourself and you will pay for that yourself. And I think it probably leads some families to not get the testing they ought to be getting because they aren't prepared to jump through these extra hoops and pay this extra money to get the care that they thought their midwife was going to deliver.
Have to do, we paid separately. I actually did do a glucose test, but I don't know how accurate, or I don't know anything, because you had to eat like a certain thing and we got like pricked and whatever, like on the finger, like what they would do for like diabetes or whatever. But
That's not an accurate test.
There you go. There you go. I see. I didn't know. I was a first time mom. So I
Right.
was like just going through whatever, but I had to pay for that. So everything
Wow.
was like whatever. And I did an ultrasound, like, whatever, when stuff happened and I had to do an ultrasound, everything we paid for. So we had to pay, and the ultrasound, like, they're not cheap. Like, I think the one ultrasound was like, I don't remember, $100 or something like that. And I had then later on at the end, when I had BPP ultrasounds and all the stuff, I had to pay for those too. And so everything was like, you had to pay, you had to have cash up front. But yes, the testing, yeah, I didn't do any testing. I didn't do any accurate testing. I didn't know at the time. Like, I was like, oh yeah, but I also thought I had a nurse midwife, and I thought that she was doing all the things that you would normally do for a birth. So I had no idea. I just was following along with everything she had me do, and turns out it's not how that works. So yeah. Another question is, with people choosing a home birth, do you think people heard about it from friends or family to get this idea of a home birth?
Yes, I did. I mean, I said that there was no midwives anymore in the hospital. My mother-in-law was like, well, I had home births for both my kids, and my best friend is a midwife, and you need to go see her, because then you can have, proper birth. Like, seriously, she's like very, very, my ex mother-in-law, very, very nice, was the one who directed me to my first midwife. Not the same midwife that I lost my baby to, but my first home birth was her best friend.
So for me, I mean, it was 2010, 2011. And that was the biggest time when it was Cafe Mom. And that was the social media. So, and particularly for me, it was a car seat group. And, car seats kind of go hand in hand with natural community. And so that's where I heard it, and heard a lot of the, pros about it, no cons. A lot of people were having home births that looked awesome. So social media, in my experience, when I considered a home birth, and that was a VBAC.
Mothering.com.
Right.
Mothering.com,
And
yeah.
Candace,
Yep.
think of the irony of the car seat group, of these women who are like 5 point up to 40, 50 pounds, chainmail armor. I mean, whatever, to keep your child safe in the car. But oh yeah, we're just gonna have home birth.
Right.
It just, to me, I don't understand, I just can't understand it.
But it's true. It's really, really true. Those two things do go hand in hand.
I know. It does. It does.
For
So social
me-
media does play a big part of it. I know.
For me, I would say I came across the information about home birthing, and I was kind of inundated with home birthing actually with my subsequent pregnancy most. And I came across it in like quote unquote moms groups and things like that on social media. But particularly I didn't know about the Great VBAC group at the time. And I was trying to find information on different things about VBAC at that time. I knew, I didn't inherently have a terrible first delivery, but it ended in a C-section. My recovery kind of sucked, and I had choreo, and I felt like crap for a while after it. And so I did want a different birth experience the second time. I was hoping to have a vaginal birth the second time. And so when I was in those, that's what's scary to me, is those are the places that I was getting the most information about home birth. Well, if you want a VBAC, you have to have the baby at home, because otherwise you're going to get, all these rules imposed on you, and you're going to have all of these things that are going to just contribute to you needing another C-section. So if you want to avoid that, you need to have your baby at home. So, I did have a baby in a hospital, and I went on to be one of the people who has a uterine rupture during their VBAC. So for me, like if that would have been a potentially likely fatal decision for my baby, and could have been a very dangerous situation for me, more so than it really already was. So I would say I heard about it in VBAC groups.
Yeah. And I think that was a main player for a lot of people considering a home birth when they want to try a labor or a VBAC, is because, you do hear about restrictions at hospitals or certain criteria you have to meet. And you will take that and say, well, there's no way I'm going to be able to have a vaginal birth if I have it in the hospital. But those things put in place are for the safety of both the baby and the mother, which, you kind of lose sight of when you hear the misconceptions or why you should do a home birth. So that goes back to the first question of maybe why some people consider a home birth.
I would say that for women who intended a vaginal birth and had a C-section that ended in a C-section, that they're going to feel somewhat thwarted. And it's an easy sell for the natural birth community to say, well, you didn't need that C-section, your baby didn't need that C-section. And if you go into the hospital, this is going to happen to you again. Even though that's not true, and the hospitals are very good at getting healthy babies out of pregnant people, and they want a VBAC just as much as you do. So the thing about that is it's very, very easy sell, and especially once they kick in that good old unnecessary concept, it will lead people to question what happened to them, which is why I think it's very important for providers to go over what happened at your birth with you, so that you are comfortable that you do know and you do understand what happened and why. And so the person who pops up with the unnecessary, and you can sit there and go, you weren't there, you don't know what happened.
Right. And I think a reason for the choice is just, look at our medical care, our system. You see the doctor for 5 minutes, and here it is, you're in this happy time of your life, and it seems very cursory, when in fact all that experience is just getting distilled down in a couple of gropes of your belly, and looking at your what the nurse took, your blood pressure and everything, is going to give good medical care. And the birth center in Charleston, you would get an hour. You could bring your whole family, and you just get a whole hour to talk and go over everything. And so, especially since you can bring the whole family and everybody's involved and they have toys. So that's the kind of experience that appeals to people. So then that's easy. They don't think, especially with the name birth center, then they think it's something official. Yeah.
True. The first time that when we met with our midwife, when I was doing my research that I thought I was doing, and I was picking out my midwife, when we first went to meet with her, we spent over 2 hours at her house, just talking about stuff, talking about, whatever. And that right there makes you feel like you think you're having a provider that's your friend, that's somebody that cares about you, that cares about your baby, that, that wants you to have a good pregnancy, wants you to have a good outcome. Like that's, it was very appealing, and it was very easy for the way I had met other midwives, and it didn't really click in. And then with her, I just was like, oh, she's perfect. She gets us, we get her, like she's listening to what we have to say. And that was the big thing, is she was seeing both of us, but she was listening to what we had to say. And that was a big, huge step of whatever, because I was very unsure. To be completely honest, I did not want a home birth. I actually didn't want to have birth at home at all. I was cool with being in the hospital or a birth center, but in my state, we have no birth centers, or we might have them now. Like I think we might have started one in the past year, but we didn't have any birth centers. They were not legal here. They're just not here. So I looked for a birth center because that's where I thought I would have whatever. Later on, did I know that basically a birth center and being at home, unless a doctor is there, it's the same thing as being home. Like I didn't know that. I thought they were different. I thought they were like a smaller, more condensed version of the hospital, but they're not. But that's really what I wanted. But instead I ended up, she was the home birth midwife that I ended up choosing for I wanted a water birth. But that's what I liked, was we weren't being pushed in and out. We weren't having a nurse do stuff, and then we see the doctor less term than we even seen the nurse. We got a lot of time, and every appointment that we went, we spent hours with her, just going over everything, just talking about, like, it's almost in a weird way, it was like kind of almost just hanging out. And so that's what it felt like. It's very, I don't know, it's very easy. You're paying your friend, I guess, but is what it felt like.
How many midwives did you interview before you picked yours?
I reached out to 3, and then she was like my 4th. One, I went with my friend to her. There was 2 big major natural birth communities. One that's more like, I guess you can say kind of more medical, but not really, because they still don't do anything, whatever. And the other one is super extreme, like natural. And they don't do any ultrasounds. They don't do any testing. They don't send you anywhere. They're just like complete opposite. The other one, they'll transfer you and they'll send you places, which was a misconception because they were both CPMs and I did not know that. So when I went to the one with my friend for her midwife, it was a group setting. We went into a building, like in a strip mall, like almost like a doctor's office. And the room was all open and there was kids all over and everybody's on like birthing balls. And she had a little bed thing over there and we would all go over and she would check our stomach. And that was like your appointment. You did like group appointments. And I was a first time mom and I was like, that doesn't appeal. So I didn't choose her. I reached out to the head lady of the other one. She was too busy and couldn't fit me in. I tried to whatever with other people, a couple other, there was like 1 or 2 other ladies that it just didn't work out. And then here was this other one that I emailed. She emailed me right back and then was like, oh, come see me and blah, blah, blah this weekend or whatever. And I was like, okay, she fit me in. What was another thing, because in my mind, you want to be able to talk to your provider. You want to be able to call them on the phone. And if you can't get a hold of them because they're too busy with life or with a bunch of other people, then it's kind of worthless for you to get a midwife, especially. Like you have to be able to contact her. So that's how I ended up picking her. Was she just ended up fitting in the thing of the mode of, she was available, I guess, in a way. Okay. So
how about for you, Liz? I know you said you had a midwife the first time and chose a different one the second time. Is that because of a move or something particular?
No, it was because my birth with the first midwife was, first off, I did not like her assistant at all. She drove me batty, and she was like all in my face the whole labor and kept like telling me how to breathe and how to move and all this stuff, which I found very invasive because it's not like it was medically relevant. It was like none of her business. And I'm like, and she wasn't who I hired. But then my midwife ended up checking me at some point and saying, oh, you just have a cervical lip. And then she proceeded to push it, like open it against, and I was screaming at her to stop, and she wouldn't take her hand out of me and wouldn't stop. And it was not medically necessary. No doctor does that at the hospital. They do not force your cervix back. But she kept doing it while I was screaming, and it was traumatic for me. I don't like when people say birth rape and all that, but the feelings that I had in the year after that were very akin to having been date raped when I was a teenager, and which had happened, and it was like it kept bringing back all this PTSD of the So when I chose a new midwife, I didn't want to go when I was pregnant, and I didn't want to go with her. I wanted a midwife that would be as hands off as possible. I didn't know I was sacrificing safety by looking for that, because I thought all the licensed midwives were the same. So I interviewed like 3 or 4 and kind of was like, if this scenario happened, like, what are you going to do? Like, I wanted to be able to just like limit the checks and like, the like, basically, I don't want you sticking your hands in me without my permission, like, was kind of what I was looking for. And the midwife that was most like down with just being like, I'm very calm and quiet and gentle and sweet, had been my birthing classes. I'd done birthing classes in my one before. She was my teacher at the time, because she was finishing her training like with another midwife. And so by then, like 2-3 years later, she was licensed. And so I interviewed her last, and I was like, oh, well, you're licensed, like, you must have done like a lot of births. And she's like, I've had to, I don't remember how many she said. It was like 150 or something. I'm like, oh, that's gotta be enough, right? Like, I mean, I didn't know. Looking back, I just feel stupid saying these things, but like, I'm like, okay, you're good. And she just seemed so sweet. And she was so like, oh, it wouldn't be like that with me. And it wasn't. She was very hands off enough that my baby died. But, like, it's just, I don't know. That's why I chose that one. The first one I just chose because that's what my mother-in-law said, you need to pick her. And I never interviewed anybody else. But the second one, I did interview like probably 3, maybe 4 midwives before I picked the one. I already knew her. So it felt really a lot more comfortable. So